We're at work here. It is a Tuesday, starting off the vlog. I have clinic all day today, so I'm going to be taking care of that. I got patients from 7:30 all the way up until 4. It's currently, 8:30 right now, so I'm at the beginning of the day. Today I'm going to be talking to you guys about the different specialties that are in PM&R. There's not too much going on vlog-wise, so I'm going to make this more of a topic video, but you'll see a little bit about day-to-day going on here today, and then I'm going to talk about different specialties that there are in PM&R, so stay tuned.
So a lot of you guys have been asking for more content related to physical medicine rehab and specifically explaining the different subspecialties or fellowships that exist within PM&R. I'm a man of the people. I'm here to help you all. One of the goals of this channel is to provide some sort of mentorship through it and just provide education because I got a lot of help throughout my kind of medical journey, so I'm here to give back. So in this video, let's talk about the different fellowships or subspecialties that come out of a physical medicine rehabilitation residency. First up, to understand any of these subspecialties, you really have to understand what a physiatrist is or what the field of PM&R is. Luckily, I have a video for that here, recorded quite a while ago, so make sure you go and click that so you know a little bit about what the field in general is all about. All right, first up, we have brain injury medicine. Brain injury is pretty much anything that has resulted in some sort of decrease in function relating to a trauma or insult or whatever it is to the brain. This can take the kind of stance of post-surgical stuff, so if someone's had a brain surgery for a tumor or whatever it may be. It can also be things like traumatic brain injury, so if someone's been in a car accident and just had like massive trauma to their head and had massive bleeding, all the different kind of stuff. And it can also be things like non-traumatic brain injuries, like things like hepatic encephalopathy, where you have just a brain injury due to a bunch of metabolic or other things going on. All of that kind of constitutes brain injury. And brain injury physiatrists focus mostly on pathologies relating to brain injury medicine. Brain injury physicians work in pretty much the inpatient and in the outpatient setting, just like most other physiatrists, and they have essentially a lot of overlap with other physiatrists on general neurological type things. There are unique diagnoses that brain injury physiatrists will see, and that's things like disorders of consciousness, so that's things like comatose patients, minimally conscious patients, vegetative state patients, and kind of helping patients emerge from that kind of state. They also manage things such as agitation in brain injury patients, which really is striking, and it's something that a lot of fields don't really see that much, and this is very striking once you see a patient who is agitated from a brain injury. They'll also help manage emergencies of things like neurostorming is kind of the colloquial term for it, or paroxysmal sympathetic hyperactivity. I haven't done brain injury for a while, so forgive me. But they'll deal with a lot of different kinds of things. And the clinic generally revolves around those same diagnoses, same kinds of patients, and helping them longitudinally throughout their issues. Next up is spinal cord injury, and this is one of those subspecialties that physical medicine rehab really owns. We are the masters of spinal cord injury, and the name is kind of self-explanatory for what this is. It is patients dealing with injuries to their spinal cord. Typically, this ranges from more severe spinal cord injuries of things like a paraplegia or quadriplegia, where patients are unable to use their legs or all of their forelimbs, and it can manifest in a variety of different ways, and there are a variety of different syndromes that these physiatrists help manage. However, the biggest things that relate to spinal cord injury are essentially every organ system. Everything's affected by the spinal cord. There are things like bowel bladder issues, skin changes, obviously muscular changes. There's things like spasticity. Spinal cord injury is huge, and there's so much going on with these patients. There's so many considerations to have as far as metabolic health for these patients, exercise considerations, screening considerations. There's so many different things. I actually have a podcast out on this coming up, so make sure you follow the Preventive Medicine Podcast on social media. It's Prevent Pod, or our website is preventivemedicinepodcast.com. Make sure you keep an eye out for that podcast because we'll have a little bit more with the chair, essentially, of our program over at Medical College of Wisconsin. Spinal cord injury physiatrists, once again, both work on the inpatient and in the outpatient settings and are extremely valuable when it comes to consultations because this is one of those things that we uniquely manage. There's certain emergencies that come with spinal cord related injury that are very well managed by physiatrists, and also things like baclofen pumps, which are very prevalent in these patients that are also managed by physiatrists. All right, next up is cancer rehabilitation. Cancer rehab is one of those smaller niche ones of PM&R, but really this comes back to the definition of what it means to be a physiatrist, and that is that we help people regain their function and quality of life and focus not necessarily completely on kind of the pathology of what's going on, but more or less the things surrounding it to help maximize that person's life. And that really emphasizes itself in cancer rehabilitation because obviously we're not managing chemotherapy, radiation, those kinds of things. We're helping manage a lot of the sequela of those kinds of things, and that relates to things like making sure patients are able to eat properly, whether that's nutrition counseling or the appropriate kind of referring for that kind of thing, working closely with dietitians. It also works very closely with physical therapists, occupational therapists for maximizing function, those kinds of things, and also helping reduce medical usage of other medications that might be interfering and reducing that patient's quality of life. So if someone's on a lot of pain medication for their cancer rehab, sometimes a cancer physiatrist will help and manage those things and help kind of optimize those so that someone's not just groggy and cronked out all day from a bunch of opioids. But it's one of those niche ones that I don't know too much about. So if there's any physiatrists out there that do cancer rehab, feel free to comment what I'm missing. But this is really maximizing those patients' quality of life that do have cancer diagnoses. Next up is pediatric rehab. This is for your little kiddos that have unfortunate issues with growth, development, all those different kinds of things. And usually this relates to either genetic diseases or things like cerebral palsy, which occur either in utero while a child's very, very young or whatever it may be. But largely it focuses on helping these kids grow and develop as normally as they can. And a lot of times this involves a lot of coordination with things like physical therapy, occupational therapy, school-based programs when it comes to that, helping navigate resources for these kiddos and for the parents, and then also doing procedures, because there's a lot of procedures that are relevant in this field, such as botulinum toxin injections, baclofen pumps, and a variety of other things. But essentially the goal is to help these kids maximize whatever they have and try to regain and get as close to that normal growth curve and kind of normal growth function that we can. A lot of the knowledge related to pediatric rehab needs knowledge of kind of pediatrics, so things like the milestones and a bunch of just pediatric physiology that is different from adults. So I can't say I'm anything nearly close to an expert in that. At the Medical College of Wisconsin, we have a fantastic peds kind of exposure there, so I do know a little bit more about it. But there's quite a bit going on in peds. There's a bunch of rare diagnoses that you will never hear. You don't really necessarily need to know the nitty-gritty of these diseases, but you need to know how they kind of affect the patient and the kid and how you're going to be able to maximize their function and get back to either school, be able to participate in school activities or whatever it may be that the goals are. And obviously there is coordination with parents in this as well, which makes it challenging. And obviously when these kids get older to like 18, 19, however it may be, sometimes pediatric physiatrists just kind of stay on with them, because when we all train, there's not a separate pediatric fellowship for, a rehabilitation fellowship for pediatrics people. It's more or less just a pediatrics fellowship after rehab. So most of us are obviously trained with adults. So we kind of carry on, there's a larger continuum of care with this kind of specialty as well. All right, now it's time for the heavy hitters, and I don't say these as saying these are the best fellowships out of PM&R. I'm saying these are usually the most popular fellowships. The first one of these is pain medicine. Now, pain medicine is something that essentially involves with pain, and largely this deals with helping patients regain their quality of life and functional life by helping them get out of pain. This takes the form of procedures in the form of injections to a variety of different joints, areas, into the spine, wherever it may be. Also more advanced procedures when it relates to things like inserting spinal cord stimulators and a variety of different fusion type things that are non-surgical. Also getting into minor surgery areas, but then also chronic pain management as far as medications go. So managing things like opioids and other pain medications. And this also kind of overlaps a little bit with cancer rehabilitation in the sense where if you are consulting a pain management physician on the inpatient setting, then they might be the ones helping manage that pain regimen for this patient. They're also commonly used in post-operative or pre-operative settings when patients are getting like nerve blocks for surgery or procedures, or they're doing like pain catheters for procedures and whatnot. So essentially anything revolving pain and alleviating pain is where pain physicians come in, and physiatry is a very common path to get into that. Usually it was mostly anesthesia back in the day, but now that's shifting much more to physical medicine and rehab, as you can see in recent trends and data and whatnot. So that it pretty much deals with eliminating pain however you can. And the last heavy hitter is sports medicine. Now, this is probably by far the most popular fellowship out of physical medicine rehabilitation. And this is largely because a lot of people who go into the field really like musculoskeletal medicine, and we really like to maximize kind of our form, function, all those different kinds of things. And sports medicine is essentially a lot of those kind of combined. Sports medicine essentially deals with musculoskeletal medicine that is kind of non-invasive or mostly conservative care. And it comes to doing things like managing and helping diagnose diagnose sports-related injuries or just general musculoskeletal injuries. In a day-to-day life, most sports medicine physicians are not dealing with athletes for the most part. They're dealing with regular everyday folk, usually older folks who have things like knee arthritis, hip arthritis, back pain, those kinds of things. However, most sports med physiatrists also do have some sort of requirements of taking care of some sort of team, whether it's a high school team, collegiate team, and some who are also taking care of professional athletes as well as part as like professional team doctors. But for the most part, they're dealing with musculoskeletal injuries. As far as kind of procedurally, usually they are limited to ultrasound guided procedures as well as fluoroscopy for the lumbar spine. Sometimes they will venture out and do other things related to that. However, this is mostly not as procedurally dominant of a field, but it's mostly just dealing with musculoskeletal injuries. Usually these physicians are not doing very much inpatient work. The rest of them have at least a large scope as far as inpatient goes. When it comes to pain medicine, there's obviously pain medicine consults that can be done for an inpatient. However, for sports medicine, usually there's not a consult service for this. Usually this is a completely outpatient based field with the addition of obviously extracurricular work, taking care of sports teams and whatever that may be. And last, but certainly not the least, is my fellowship of choice, and that is Sports and Spine, or a Interventional Spine and Musculoskeletal Medicine Fellowship. It's not pain, it's not sports medicine. I personally think it's the best of both of them combined into one field. It is not an accredited fellowship out of physical medicine rehabilitation. However, I made an entire video that'll be in one of these corners up here that kind of talks about that, so make sure you go and check that video out. All right, that is it as far as this video. That covers pretty much all of the fellowships that are coming out of physical medicine rehabilitation. If you have any questions or if I've missed anything and you're a physiatrist that does one of these things, make sure to comment down below. Let's start a discussion and see what the best parts of each of these fields are. Hopefully this is able to help someone out there who is either deciding between some of the fields or who is thinking about physical medicine rehab and doesn't know kind of what the fellowship options will be afterwards. As always, I'm very happy to answer questions, so feel free to drop them in the comments below. Find me on a social media platform and DM me there. I am extremely happy to give back, and if you found any value in this, make sure you subscribe to this channel for more videos similar to this and other vlog style content. And once again, thanks for watching, and I'll see you in the next one.